Hey y'all, so today we'll be talking about a very important topic that is in a lot of people's mind when it comes to how to improve America. Healthcare. So first of all, what is the issue? Well, it's quite complicated, but let's go over it as simply as possible. The issue we have is that our current healthcare system is not as accessible as many people think it should be, and with good reason. It is without question flawed, but little has been done to actually help. There are opposing views on what should be done, if anything at all, and we'll talk about these: free versus affordable healthcare. Free means that we would allow everyone to have healthcare without having to pay for it, just like Canada or the UK. Problem is that we have a hard time imitating these countries in their healthcare, and it has a lot to do with how set we are in our ways. Plus, it would be kind of expensive. Therefore, we come to the alternative, affordable healthcare. With affordable healthcare, we could be a lot more in control of the change that needs to happen, and we could fix a lot of the issues that come with a sudden transition into free healthcare. You see, with free healthcare, you would burn through medical resources very, very fast. This means that we would not have enough of anything to help everyone who would go into a hospital or pharmacy to obtain the care they need. This is a very serious issue because we could potentially be taking the resources away from someone who actually needs them and giving them to someone who maybe didn't need them as much, such as the issue with supply and demand. It is horrible to think that we would need to make choices on who gets what just by arrival time. Not to mention, we would also overwhelm hospital staff too, making doctor visits impossible to book when you need them unless you call months in advance. In fact, it is estimated by the AAMC that we will be losing hundreds of thousands of doctors in the not-so-far future. They estimate that we would experience a shortage of over 120,000 physicians by 2032. According to Fraser Institute, it may take up to 6 months to book an appointment in Canada and then wait another few weeks to actually see them. The worst part is that it shows no sign of improvement since 1983, when the waiting time increased by over 100%. What are you even supposed to say to that? I'll be sick in a year? With affordable healthcare, we would not overwhelm our doctors and hospital staff, and we would keep their working conditions appropriate and our waiting times reasonable. I'm sure we can all agree that we don't want to rush them and overwhelm them, because then the quality of care goes down, meaning they wouldn't be able to provide the level of care that is needed. Then back to the question of why we can't just copy other developed countries' healthcare systems. Well, for one, Americans are very stubborn. Let me explain. We are always divided and we can never come together because we don't want to compromise. I mean, between Republicans and Democrats. We need to understand that the people fighting most towards free healthcare are the Democrats, and they want the rich, mostly Republican people, to pay for it with higher taxes. Of course, this wouldn't go well with them. In fact, everyone would be paying for services they do not need and that other people would exhaust, as according to a finance blog called Vitana, about 5% of the population use up about 50% of medical resources, while the healthiest 50% only use up about 3%. But what does that mean? It means that 50% of healthy people would be paying for 50% of resources, while only actually using 3% of them. This all sounds bad to think of as numbers, but it's reality. Plus, they also mention a lot of these issues could be solved by simple lifestyle changes that would make everyone healthier, and people wouldn't need to pay as much if we all did just better as a country. Nobody wants higher taxes, therefore we can't raise everyone's taxes either. And we can't take it out of the defense fund because we're the big strong jock in the world and we can't show weakness. That is a whole other talk though. Anyway, with affordable healthcare, we wouldn't need to raise taxes, or at least not as much. It sounds bad, but affordable healthcare would still keep some people from using up unnecessary amount of supplies. Plus, we wouldn't overwhelm our doctors as much, and we would allow whoever makes the rules some more control over how to manage such a big change. Plus, the upside is that this would be the middle ground, and we could make a lot more people agree on the plan than oppose it, even though there will still be someone upset about it. It is unavoidable that we will not get everyone on board, but at least we can force this without total mayhem. Why can't we all just get along? I digress though. We need to discuss one of the solutions that had been proposed to push forward free healthcare. You see, many politicians have proposed ideas on what to do about our healthcare, such as with Obamacare, but we'll be talking about Bernie Sanders' proposal and why it wouldn't be able to work, since we already talked about the raising of taxes, which was what he proposed. The reason he wanted to increase taxes by 70% for the rich was that he had planned to eliminate insurances and just have his Medicare for All plan cover everything. This is an issue, first of all, because it would take away thousands of jobs. Also, any people with private insurances would have to accommodate to the same care that everyone would receive. Some people have private insurances because they essentially get a fast pass into receiving a lot of specialty treatments they might need. Look, insurances suck, and I would know because I deal with them every day at work, but we can't just get rid of them. There's too much risk in that plan. Without insurances, doctors would get paid per visit through federal pay, causing them to lose a lot of money. This would discourage a lot of people from wanting to become doctors in the future and contribute to the shortage mentioned earlier. Through affordable healthcare, we could force employers to provide insurances to eliminate this issue altogether. There are many things that can go either very right or very wrong, but I can't list them all in one 5-minute video, so I encourage you to go inform yourself on the issue, and together we can all make this issue go away. We can't just leave it the way it is now, because as we stand now, we are having to deny care to many people who need it, especially when COVID was at its peak. So please, for the well-being of everyone, try to understand the issue thoroughly. I will provide the links to the websites I visited to inform myself, but I encourage you to find your own sources too to generate your own ideas on the issue. Anyways, thanks for watching, y'all.